Hi everybody, welcome to the online talk, STEAM therapy, looking at vaginal STEAM case studies for common menstrual and reproductive health issues. I got my notes over there, make sure I say it right. Okay, so I'm Keli Garza. I'm the founder of the Peristeam Hydrotherapy Institute, which is the only institute in the world dedicated solely to the research of vaginal steaming and training skilled STEAM practitioners. I am also the founder of what I call Peristeam Hydrotherapy, which stands for Perennial Steam Hydrotherapy. I shorten this all to STEAM therapy, just in common language, but that's what we're going to be talking about during this talk. Okay, so Peristeam Hydrotherapy is the skilled application of steaming to common menstrual and reproductive health problems with specific protocols that have proven results. Okay, so this is a little bit different than like, I have this problem and I heard steaming can help, let me see on YouTube how to steam at home, and then pulling spices from your kitchen and then putting a bowl in the toilet and steaming. That's not what we're talking about here. We're talking about a much more systematic approach. Okay, so through the Peristeam Hydrotherapy Institute, with a group of my practitioners, we started a database several years ago called the Pelvic Steam Testimonial Database, where we collect testimonials of people of what problems they had, what steaming they implemented, what herbs they used, how long they did it, and then what results they had. Okay, and so you can see different patterns for people who had menstrual problems, or different patterns for people who have fibroids, endometriosis, and so forth. Even before that, I had done something like that individually, whereas I collected over 700 case studies of people that I worked with one-on-one on their starting cycles, what different issues they were having, how they implemented steaming, and then, or we would implement different steam protocols and then see what results. And sure enough, over time, I was able to identify patterns and be able to create specific steam plans in order to get, not in every case, but in order to get pretty predictable outcomes as a result of the steam plan implemented. So here, during this talk, I'm just going to walk through some of these common menstrual and reproductive health problems and talk about what my observations are with steaming and share some case studies. The reason why I'm giving a talk like this is because, again, steaming might be something that people find at the spa. It might be something that's a cultural practice, something that might be done, like in the family, postpartum, or after a first, somebody's menarche, after their first period. But I do find that there is not really enough knowledge and application, there's not enough knowledge about how steaming can be applied in some of these very common issues that women deal with around the world. And also, a lot of these issues end up with surgeries, pharmaceuticals, and things that sometimes work well, but often don't really work that well. And when people are looking for alternatives, it is important and good to know how steaming can possibly help in these situations, so that people can make the choice of what works best for them. Okay, so the first topic that I'd like to discuss is fibroids and how steaming impacts fibroids. So what I've seen, so I'll just start off. Fibroids is a major problem. A lot of people have them, and they are a major cause of surgery, whether that's a myomectomy or a hysterectomy, or even there's some other ones as well. But definitely a lot of people get surgery because of them, and there is a pretty high rate of recurrence. So even after surgery, that the fibroids might grow back, and that another surgery might be necessary. I think it's the last time I looked into it, it was something like there's going to be a 50% rate of recurrence at the 1 year mark after the surgery. And usually the recommendation after, if there's been a recurrence, is going to be full hysterectomy. So a major problem. A lot of people use steaming to manage their fibroids. And then some people use steaming successfully in order to completely get rid of their fibroids. And some people are able to use steaming in order to be able to prevent surgeries, others not. These are just like from what I've seen. I personally had, I was diagnosed with 3 fibroids when I was pregnant with my first child. Once I gave birth, I did steaming every day for 30 days consecutively. And I talked to a friend of mine who was an acupuncturist, and she said she was going to give me herbs to help disintegrate the fibroids. I never took those herbs. After that 30 days of steaming, those fibroids were gone. So I've never had fibroids since. At the time, again, so steaming might be used, but in this case, I didn't know or realize that the steaming could or would have an impact on the fibroids. After that, I think within that same year, a friend of mine contacted me. She's a medical doctor, and she was currently in her residency at the time, and she was diagnosed with fibroids. And I recommended steaming to her, not because I knew that steaming could have any impact on fibroids, but because of all of the, because of what was going on with her period, and just a lot of pain and heavy bleeding. And I had seen steaming be helpful in those cases. So I recommended it to her, and she contacted me, and over text, all caps locks with a lot of exclamation points, that one of her fibroids had fallen out. And she actually, it happened while she was using the bathroom, and she said that she didn't collect it, but then I think it was the next day or soon thereafter, another piece of a fibroid came out while she was in the shower, and that one she collected and she took to her professor, and again, another medical doctor, and the medical doctor confirmed that that was fibroid. So this was a crazy experience, and it's when I, started to realize, obviously, that steaming might have an impact on fibroids. I have since then worked with a lot of people to help them with fibroids, and I can say this. Steaming for fibroids requires diligent steaming. It requires a lot of steaming. It requires making steaming a lifestyle practice. Secondly, steaming with fibroids isn't always safe to do. I highly recommend working with a certified Peristeam hydrotherapist, because fibroids, not all fibroids, but a lot of times fibroids also end up causing bleeding issues. Steaming should never be done while actively bleeding, so that becomes a bit of an issue. When people have sometimes regular spotting because of these fibroids, or heavy bleeds, or spontaneous bleeding. So you never want steaming to be something that could instigate that bleeding, and it's really important to use herbs that are going to stop bleeding, rather than herbs that might bring the onset of bleeding. Okay, so there's some skill level to that, and then also the schedule and how long to steam. A lot of people are only going to be able to steam for 10 minutes. They're not going to be able to steam longer if they have uterine bleeding sensitivities and so forth. But yeah, a lot of steaming, and also a dedication to period care. So steaming helps to loosen up anything in the uterus, right? It's bringing circulation to the area. It's bringing heat to the area. But the period is what actually causes things to come out. In general, what's happening is that as the uterus has its period every month, this is a natural cleanse. And so the fibroids can naturally come out during that time. Sometimes people do see fleshy, white or yellowish, clumps. And sometimes people don't. And they still can use, through ultrasounds, can still see that their fibroids are shrinking. So I don't know what's going on there when they don't necessarily see them, whether they maybe just, I wrote a blog once, like fibroids are melting out, so I don't know if they just start to melt or what happens. But a lot of people have had success. If the goal is to avoid surgery and to get rid of the fibroids entirely, I recommend really regular steaming and getting a steam plan at least once, just doing one consultation with a Peristeam hydrotherapist in order to get the right herbs, the right steam schedule that's going to work for that individual. If the goal is to be more comfortable with the fibroids, then any steaming can help, like weekly steaming. Often, again, is something that helps people to manage their fibroids a lot better. It can help to decrease some of the side effects that a lot of people have from steaming. And that's where, the steaming at the spa, the steaming at the women's gathering, all of that is still going to be helpful. It's not necessarily going to create the same results as like getting a specific steam plan to target, trying to reduce and get rid of the fibroids. I have seen fibroids get completely eliminated, like going from large, the largest one I've ever worked with was the size of a watermelon, to completely zero. I've worked with fibroids where there's been 17, 18, 19, 20, tons and tons of fibroids down to gone. Very often within 3 months, there's a significant difference. I do think it's good to do ultrasounds. It's good to have a starting ultrasound. If somebody knows that they have them, I don't think, and they don't have easy access to ultrasounds or affordable access to ultrasounds, I don't think you necessarily need to do that starting one if it's already been confirmed. But I do think after 3 to 6 months of, dedicated following a steam plan for fibroids, I do think that it's good to be able to do an ultrasound to make sure that the fibroids are getting smaller and that it's going in the right direction. In general, for fibroids, it does take dedication, and I recommend dedicating 6 to 12 months to doing it. I will say that while also saying that people often have a reduction in the side effects as soon as the first month after steaming with a dedicated steam plan. So definitely worth it. It definitely can increase, can improve the quality of life. Even if somebody's waiting for surgery and they know they want to do the surgery, for sure, it can help to make things more comfortable. In the case that people do surgery or planning to do surgery regardless, I'll share with you a case study of a woman. She had been steaming, and she was steaming while she was waiting for her fibroid surgery, and she did a myomectomy. And in her case, the doctor told her afterwards that her fibroids were unlike any fibroids that she had ever encountered before. She said usually they're like more solid. She said in her case that they were like jello. She said she removed and was able to remove all of the fibroids. She said, and they were giving away. She said they were giving way, kind of like jello gives away under a spoon. So that was a really interesting observation from a doctor who did a fibroid surgery on somebody who had been steaming prior to that surgery. Okay, so I regularly get the question about fibroids. So what herbs did that woman use who, for example, had the jello-like fibroids? Or what herbs did the woman who had the watermelon-sized fibroid use? They use different herbs, guys. So the way that I do steam therapy is that different people are going to need different herbs. So, for example, somebody who is postmenopausal, doesn't have menstrual cycles, and has large fibroids, I'm going to give them, herbs that are very circulatory and very cleansing. Somebody who has their menstrual cycles and is dealing with has fibroids and they're dealing with heavy bleeding during their periods and daily spotting, I'm not going to give them those super strong cleansing herbs. I'm going to give them herbs that have cleansing properties, but also that have blood-stopping properties. I don't need to give the herbs that have the blood-stopping properties to the person who's postmenopausal and doesn't have any bleeding issues. I do need to give that to the person who's got bleeding issues. The same with somebody who has short cycles. If somebody's got gets their period every 3 weeks. I want to give them herbs that are going to elongate their cycle while also clearing out the fibroids. Because if I give them the other types of herbs that I was giving to the postmenopausal woman, it could make it so that their period shortens from every 3 weeks to every 2 weeks. So it is really, really individualized. All menstrual cycles are not the same. And so it's really important to have the herbs that are going to target that specific menstrual cycle. That said, the steaming itself, the opening, the circulation, and the uterine cleanse that happens after the period is what's still going to create, an effect with the fibroids. Fibroids go away on their own all the time, right? So creating a steaming practice just helps the uterus be able to do its own thing better in order to be able to eliminate the fibroid. Okay, so you got to understand that's just the first step, is that the circulation itself, even without adding any herbs, is going to be helpful. There is a published case study of a Korean medicine doctor who works with steaming. She works with steaming and acupuncture and herbs all together. She doesn't do steaming alone. But she was able to keep this woman's endometriosis away. This woman was having recurring endometriosis. She had had surgery, it came back. She had had surgery again, it came back. And I think it was after that second surgery, or maybe she had even done 3, that she started working with the Korean medicine doctor. And the Korean medicine doctor was able to keep her endometriosis free for like 5 years, and then published a case study about it, just to show the effectiveness of being able to use Korean medicine involving steaming in order to be able to keep endometriosis from recurring, because endometriosis sadly has a really high recurrence rate after the surgery. So it's basically going to be, it's like surgical management of it, which means that you're going to have to do surgery multiple times for the majority of people who use surgery as the method of treatment. So with endometriosis, I don't know how steaming actually impacts the endometriosis, right? Because it is hard to diagnose. But I do know that it's a good idea to get rid of all of the stagnation. And then again, it's not only important to steam, but it's important the period care, that when the person has their period, that they take out the tampons, that they allow, all of the old blood to clear out, all of the clots to clear out, and they do proper period care in order to be able to let all of that old stagnant, matter out. Okay, so the next topic that we're going to get into is steaming and ovarian cysts. Okay, so we just talked about fibroids and endometriosis. They take a long time and a lot of dedication. Ovarian cysts, on the other hand, I have seen respond to steaming very quickly within 1 month's time. Okay, in some cases 2 to 3 months, but like again, if you're somebody who's dealing with ovarian cysts or currently have an ovarian cyst, dedicate 3 months to steaming, and it might really be worth it, especially because ovarian cysts is something that doctors might want to resolve with a surgery. I've worked with people who have done ultrasounds. They have a confirmed ovarian cyst, the size of a grapefruit or an orange, different sizes, but very large ones. And then they steam regularly. And then the next time they do their ultrasounds, they don't have a cyst. The first time that this happened was, the most stood out the most to me, because somebody came to me and wanted to buy herbs and steam supplies, and she had a surgery date on the calendar, and she wanted to avoid that surgery. She had actually already done a surgery, and then she had done a surgery and removed one of her fallopian tubes due to an ovarian cyst, and at her 1-year checkup, they found out that she had an ovarian cyst on the other side, and so they were going to remove that, and she did not want that. So they scheduled her for surgery, and she's found the steaming and started steaming. And in her case, she was unaware that this is an elective surgery, and you could tell them that you don't want to do it. But she didn't feel like she could cancel it. So she went into the pre-operation visit, and they did the ultrasound on her, and the ovarian cyst was gone. So I remember she had picked up herbs from me and got a steam plan in March, and the surgery was in May. So within 2 months, the cyst was gone, and this was a huge grapefruit-sized cyst. So that's when I learned, oh, okay, steaming, seems to be helpful in this case. There were some other things going on with her that steaming was helpful. But I remember that she was in a lot of pain, like she had fixed pain on a daily basis. And she contacted me after her first steam session and said she was in less pain. After the first week, she said she didn't feel any pain at all anymore. So that was, to me, that was already successful, that she would have a reduction in her pain and no pain on a day-to-day basis, because it was impacting her work, it was impacting her the intimacy, with her husband, and just really, causing a lower quality of life for her. So the steaming in her case was able to bring that pain down, and then the ovarian cyst went away. So I've worked with people, I'm not sure the exact number, but I've worked with people with ovarian cysts since, and it's never really been a problem getting rid of the ovarian cysts. Now, sometimes the cysts come back, but it's like a common thing. Like, the person got an ovarian cyst, they steam, the problem seems to go away, and then a cyst comes back. But as far as a cyst, like, I can't say steaming is getting rid of the ovarian cyst, because we don't have any study that shows that. But I do have observations to say people who have ovarian cysts, who steam, their cysts seem to dissipate, whether that's because of the steaming or not. And that seems to happen pretty easily within 1 to 2 months time, really. But I'll just go ahead and say 3 months, so that you guys, anybody who's dealing with the ovarian cyst, just is really ready to dedicate some time to it. Again, ovarian cysts, people who have ovarian cysts have very different types of menstrual cycle patterns, and a lot of times they need herbs with opposite properties. People with a lot of short cycles and a lot of bleeding issues, they need herbs that help to stop the bleeding and elongate their cycles, while also helping to dissipate the cyst. And then the people who have long cycles, missing periods, and so forth, they need different types of herbs. So those are herbs that have opposite properties. But steaming for ovarian cysts, I highly recommend it. To try it for at least 3 months before electing for a surgery. And I recommend getting a specific steam plan from a Peristeam hydrotherapist, so that you know for a fact that you have the right amount of herbs, you've got a good steam schedule for your menstrual cycle, that you're steaming the right duration of time and with the right setup. Okay? All right, let's talk about steaming and PCOS. So from my observations, steaming's helpful, but it's not usually everything. So PCOS does tend to have, people with PCOS do tend to have stagnation, which is again where steaming is a superstar. So clear the stagnation. Often clearing that stagnation can help get the cycles down to a normal length, and can get the cycle more regular, right? And then also it can help to decrease the pain that somebody has when they're on their period. And steaming can also be used during ovulation, like dry cramping and pain as well. It works to decrease, those side effects, and to regularize things in a lot of cases. It doesn't work in every case. There are going to be cases where, from my observations, there's still going to be like an underlying deficiency that has to get resolved. in order for the PCOS to entirely go away. So there's some people who steam and are able to use steaming to stay regular, and then others that still might deal with absent periods and irregular menstrual cycles, though they usually do get a little bit shorter, the cycle, and they'll be less painful once the stagnation isn't there. So it's definitely a good tool, but it's not always the whole picture. A good thing to do is to add the period care. Period care has a couple different components, but one of them has to do with the nourishment during the period, and a lot of times that can be helpful to get started to resolving some of the imbalance. But I think it's goes really well paired with acupuncture, especially an acupuncturist that does herbal formulas that can help to resolve some of those underlying imbalances as well. Okay, so let's talk about steaming and menstrual pain. So menstrual pain, from a Eastern medicine paradigm, which is, where I do a lot of my research and reading, pain is just fixed, something is fixed, something is stuck. And so when you're looking at the uterus and you're looking at the uterus, what we call cramping, it's actually contracting, and it's usually contracting because there's clots, old blood, or something that it's trying to get out. So a lot of that pain, when you think of menstrual pain, there's different menstrual pains, and I think this is also something that we can get a little bit more detailed about. But if there's pain because the uterus is doing this and that's painful, that's again because of that stagnation of there. Then there's the pain of something coming out of the cervix, which ultimately is pain because there was something stuck in there, right? So at the end of the day, when it comes to menstrual pain, sometimes there's maybe undiagnosed, this or that, endometriosis, whatever it might be. At the end of the day, you want to get that stagnation out of there. You want to have a period that begins and ends on fresh red blood, and there's no clots or brown blood at the beginning, the end, or during. And that is always going to be a pain-free period, right? The pain comes from the contracting, from the old blood, and then also from the matter moving down and out through the cervix. So steaming is really, really beneficial from what I've observed at getting rid of menstrual pain, especially when dealing with a practitioner who knows how to do this. I have seen situations where people steam and they don't pair it with proper period care. Steaming has to go hand in hand with proper period care, because the person steaming has to understand that the period is a uterine cleanse. And so you're steaming and you're creating a lot of circulation, and you're getting maybe all that stuff in the uterus loose, but then during the period it needs to come out. And so if the person has put tampons in, a lot of times that causes pain, because now you've got all this stuff that's loose, and the uterus can contract even harder to try to push that stuff out. So you're kind of working against the uterus when you block it. So it's really important to let everything flow out during the period, to have warm things, to avoid cold drinks and cold foods at that time. Just basic steps of proper period care in order to be able to get that stuff out. And then again, it's really good to steam like the week before the period, and then also after, when there's menstrual pain, in order to get all that stagnant stuff out. And if that doesn't do it after a couple months, it's worth getting a tailored plan with a Peristeam hydrotherapist in order to steam more, make sure you're getting the right herbs, make sure you're steaming with the right schedule, make sure you're steaming for the right duration in order to be able to get all that stagnant stuff out. And then as far as period care, I have a free class on the different aspects of period care. So I will share that with you guys if you haven't seen it already. Okay, so overall, when it comes to menstrual pain and steaming, very successful. I've seen it be very, very successful and life-changing for people. And that's one of the things that I just hear over and over again. Like, I wish I had known about this. Young girls need to know about this from when they start their period. Like, there's been a lot of wasted time, and women are being told that pain is normal and it's just part of their, you know, the experience of being a woman or being a girl, and that they have to survive it, you know, when somebody who has been dealing with this pain month after month, you know, for year after year, steams and their pain is able to go away, you know, it really does, you know, seem like a waste, right? So, so I don't know if all menstrual pain can go away, but I've seen it, you know, be pretty effective. I've seen steaming be pretty effective at getting rid of menstrual pain. And again, I really love like dedicating 3 months to steaming, to getting all that stagnation out. And if there's more stagnation after 3 months, steam longer. But I've never really seen somebody really, really dedicated with a steam plan, trying to get rid of their stagnation, and that lasting longer than 6 months or so. I think 5 months, you know, for people who have really bad stagnation. So it's definitely worth a try, you know, for getting out of pain. Okay, so let's talk about steaming and infections. So from my observations, steaming is very useful for addressing infections, and that's infections of all types. So bacterial, yeast, and viral infections. HPV, there have been cases of HPV that have gone away. There have been cases of cervical dysplasia that have gone away. Definitely, I think, a really great tool for dealing with infections. There is sometimes a little bit of a misunderstanding. Sometimes people steam and then they have a lot of irregular discharge come out, and then they say steaming caused them to get an infection. Steam is just water and herbs, and it does not create mucus. It can't make mucus in your system. But what it does when somebody steams is it draws out any excess mucus that's sitting in the reproductive tract. And I actually think from how I understand the steaming is working, I think that's actually part of why steaming is helpful. So for example, an approach to an infection, if somebody has a bacterial infection and they're taking antibiotics, that's great. The antibiotics will kill the bacteria, but it doesn't pull out all that mucus. Well, if all that mucus is still in the reproductive tract, that probably makes it a favorable environment for bad bacteria to proliferate, to grow, right? So killing the bacteria while also pulling it out is a really great two-pronged approach that is what you're going to get with steaming, because you can put antibacterial herbs in there and then steam with those. It's going to do both. It's going to kill the bacteria as well as draw out all of that excess mucus. And I think that's what makes it so successful. As far as the viruses, I'm not sure how that works. There's a couple different theories out there, but there are definitely a lot of people who have had HPV who steamed and then no longer had HPV. And this isn't like a situation where they have to steam for a year or something like that. Like, these have been cases sometimes where people steamed like once or twice, and then got retested and the HPV was gone. So, so steaming has been shown to be very effective when it comes to infections of all types. Definitely worth a try. Definitely worth working with a Peristeam hydrotherapist to get a dedicated steam plan to make sure you're not steaming too long. A lot of times when people have infections, they can only steam for 10 minutes. It's really important not to overdo it. And it's really important to get the right herbs and the right steam schedule. Everybody's worried about the herbs all the time. Everyone wants to know what herbs. How about how long to steam and when to steam? With infections, you might be steaming consecutive days, and that's maybe way more effective than steaming weekly or steaming before or after the period. So it's really important then not to overdo it, not to steam too many days, and not to steam too few, you know. So a lot of times there's no like set amount. A lot of times it's just working with people one by one in order to be able to figure out what makes sense and what the body is telling for when it was going to be ready to start steaming and when it's going to be ready to stop steaming. Okay. I think one of the biggest myths about steaming is that steaming is going to harm the pH balance and cause a higher rate of infections. There's so far no data that shows that. There's no case studies that show that. There's no studies that show that. There are a number of published studies in Korea about steaming being able to help with infections. And then there was this study that was done in Suriname and the Netherlands that was trying to show that people who steam will have a higher rate of infections than those that don't steam. It was trying to prove that theory correct, or that myth correct, that people who steam are going to have worse pH balance, or they're going to disrupt their pH balance, which is going to make them prone to a higher rate of infections. So this study was trying to prove that. So what they did was they went to a country, Suriname, where there's a lot of steam users, and they basically took a survey of they took a survey, of everybody to see if there was a higher rate of chlamydia among steam users versus non-steam users. And what they found is there is not. So steam users either have the same level of chlamydia or lower. They didn't actually indicate in the study. They definitely don't have a higher rate. There was also a study in India that actually measured the pH balance of people before and after they steamed and found that it was the same. They didn't find any difference in the pH balance from steam users versus non-steam users. So according to the studies, there's nothing to support that people who steam have disrupted the pH balance. And then according to the case studies, and the observations and the people that I've worked with and all this, testimonials I've heard story after story of people who have been able to get chronic infections under control with steaming. So again, it doesn't support the idea or this myth that steaming is actually disrupting people's pH balance. And I just think that's worth discussing because when you Google it, you'll see article after article of this, but you'll never see any proof of it. Where's the proof? Show me the person. Give me the person. There is one case study that was published of somebody who steamed and got burnt. Okay, yeah, that can happen. People also make coffee and get burnt, right? So there's one case study of that, but that was published in PubMed. But other than that, there's been zero evidence of anybody, whether it's just somebody using it themselves and sharing their account, or whether it was a study or even a published case study showing somebody that actually had a worse pH balance as a result of steaming and then contracted infections because of it. Okay, let's talk about steaming and perimenopause. I hope you guys don't cancel me as a result of this one. Okay, so when it comes to perimenopause, what we're kind of talking about is what people's periods start to look like in their 40s, or maybe even people are starting to talk about it in their 30s as well, and that they start to get worse and worse and worse. As a Peristeam hydrotherapist, what I have seen is that there are some imbalances that get worse and worse as they do not get addressed with time. So again, I'm going to talk about stagnation. Anybody who's dealing with really large clots and really, really painful periods, and as a result of perimenopause, this may be tied to not addressing the stagnation from month to month and how that builds up over time. Okay, there's another thing, another imbalance that we haven't talked about yet, which is fatigue. So uterine fatigue is specifically an imbalance where somebody starts to bleed more frequently. So the periods start to become, the cycles start to become shorter. So whereas somebody maybe had a 28-day cycle, now it's 25 days and 21 days, 14 days, right? They're bleeding more frequently. Yes, this absolutely appears to be something that happens with age, but age may not be the culprit. It may be, it may be resolvable, right? If you start to look at uterine fatigue. If uterine fatigue is an issue, then strengthening the uterus should resolve these shorter cycles. Often, I have seen this be the case. So uterine fatigue is resolved by, number one, strengthening herbs and hemostatic herbs, and then with steam, which can be introduced with steaming, and then secondly, through better period care. I'm always going to talk about steaming and period care. They go hand in hand. So specifically with uterine fatigue, the period care that's important is resting. So resting during the period allows it's kind of like charging the battery. So when you think about charging your phone's battery, you want to charge it to 100% so that it has a chance to last until the next day, right? Let's say 24 hours until you're going to charge it again. If you only charge your phone to 50%, then it's not going to last the full day, right? This is kind of like how our rest is during our period. If we rest fully for 4 days during the period, just a lot more bed rest, a lot of naps, early bedtimes, doing a lot less, activity. This allows us to have like a full uterus battery, if you will, and be able to make it that full month. So if you don't and you're very busy during the period, uterus might not make it. So this is significant with age. The longer that we go not giving our uterus the proper rest, the more fatigued the uterus gets, and that's why it becomes more of an issue with age. So I could be completely wrong that the shorter cycles has to do with uterine fatigue. But the way to test it is to steam with hemostatic herbs and to follow, again, it's really good to work with a steam therapist to get an individualized steam plan. Or for perimenopausal steaming, I really love weekly steaming in order to support every phase of your cycle while going through perimenopause. So do weekly steaming with the right herbs. Often it's going to be a 10-minute steam. You don't want to steam too long. You don't want to overdo it. You don't want to over tire your uterus. And see if that's helpful. See if doing more period care and like full period rest, see if that's helpful. Personally, I am in the age range of perimenopause. I'm 45 years old, and last year I noticed that my cycles were getting shorter, and I told that to one of my friends, and they were like, oh yeah, that just happens, like that's perimenopause. And I was just like, okay, well, I'm gonna try to steam. I'm gonna try to steam and see if it helps. And so I steamed with hemostatic herbs, and I focused on period care, and then I had a 29-day cycle, and I haven't had a short cycle since. Now that's just my case. That's just my case, which obviously doesn't apply to everybody. But if I would have accepted that this was just perimenopause and hadn't understood this idea of uterine fatigue, then I would still be having short cycles, and they may have gotten shorter and shorter by now. So it's really important to kind of like screen, for that uterine fatigue, and also to just assume uterine fatigue, because I don't know, women are tired. Women are tired, and they get more and more tired with age if they're not properly resting and specifically resting the uterus during the period. So give yourself those if people who are dealing with perimenopause, who are starting to have shorter menstrual cycles, just go ahead and assume uterine fatigue. Give yourself the right herbs to strengthen the uterus. Start steaming weekly to support the cycle at those 4 phases, and really, really lean into that period care as far as resting. Of course, this always goes hand in hand with acupuncture and getting some internal herbs to take at that time as well. But I do notice a lot of the discussion around perimenopause might have to do with this concept of uterine fatigue. Okay, so then there's one other imbalance that I think comes up a lot during perimenopause, or there's actually 2 imbalances, but they're related, and it's excess heat and dryness. So again, coming from the paradigm of Eastern medicine, excess heat and dryness are both related to the kidneys, and as women age, the kidneys need to be nourished a lot more. And if they're not nourished a lot more, which basically just hydrated, right? If they're not nourished more, then the body can't keep itself cool as well. Okay, so that's where night sweats pop up, or hot flashes pop up. This has to do with the kidneys being deficient and not having enough coolant, not enough moisturizing and cooling things in order to be able to keep the whole body cool. And then, of course, if there's excess heat, too much heat is going to lead to dryness, right? Just like on a hot summer day, if it's really hot, everything's going to dry out. So, yes, this may be perimenopause. And yes, these things may not be able to go away. But consider trying to nourish the kidneys, trying to, hydrate properly, going to an acupuncturist, getting internal herbs for these, and seeing if those can help the problem. Because if it does, then again, perimenopause doesn't need to be uncomfortable. It doesn't actually need to be characterized with these negative side effects, okay? I actually had this rare situation where I used to get really bad night sweats and hot flashes when I was in my 20s. And I used to get it every period. And so I went to an acupuncturist, and they gave me herbs, nourished my kidneys, and resolved the issue. I had gone to a gynecologist and talked to them about the issue, and they told me, oh yeah, that's a rare PMS symptom that you have. That's too bad for you. It's unfortunate. I know that's uncomfortable for you, but, we're all dealt, different cards as far as what PMS symptoms we have. And I was just basically told that I had to live with it. And within 3 months of acupuncture treatment, it was gone. And because of that, I learned how to nourish my kidneys. My acupuncturist taught me that I needed to nourish my kidneys with food, with diet, just on a regular basis. And so again, I'm midway through my 40s, and I haven't had any debilitating hot flashes or night sweats. I haven't had any. And again, I'm still early on. I may not even be in perimenopause yet. But I also think that I'm less likely to have severe ones since I do consciously nourish the kidneys, and have been doing so since I was in my 20s. So something to think about. So perimenopause and steaming. Yes, steaming is very useful when it comes to clearing the stagnation, which everybody should do all the time. When it comes to hot flashes and night sweats, there are people that report that steaming is really helpful for their hot flashes and night sweats. They consider it an added benefit to being able to get those under control. So I do recommend, that weekly steaming if dealing with those, but more importantly, nourishing the kidneys. I do think that there is perimenopause and certain side effects of perimenopause, but often they look like these imbalances to me. So it's like, first let's deal with these imbalances and then see what's left over then. But either way, steaming weekly is a really great way to get through the perimenopause years, especially when steaming with herbs that are helping to address any imbalances that you might be experiencing. Okay, let's talk about steaming for fertility. So steaming for fertility, of course, if somebody's having difficulties with fertility, I've seen it be very, very helpful. But I also want to say, I think that steaming should be used from when people first get their periods so that they can keep their period healthy, like have a healthy period from the start. So I think a healthy period has the following characteristics. It begins and ends on fresh red blood, and it's pain-free. There's no clots, there's no cramps, okay? And there shouldn't be any negative side effects. Maybe the person feels a little bit more tired. There shouldn't be back pain. There shouldn't be any of that kind of stuff. There shouldn't be headaches. It should just be begins and ends on fresh red blood, lasts for 4 days, and the cycle should be every 28 to 30 days. So steaming can be used from the very start of somebody's menstrual cycle in order to keep the cycle like this. This is a very fertile cycle. The person can just get pregnant like that on day 14, 15, or 16, whatever day they're ovulating, which is going to fluctuate from month to month. So I think that there's a lot of, I think that we can prevent a lot of fertility issues by having healthier cycles to start off with. And we can also prevent a lot of discomfort and pain, that especially our younger, menstruators are going through. Okay. So if somebody's dealing with fertility issues, I have seen steaming be useful. There is a fertility clinic in the Czech Republic that has started using steaming, and there's the doctor there. She actually did an interview for the upcoming steam film documentary, and I can't wait to share that with you guys. But she found steaming to be very useful, and so she now recommends it for the patients that are there before they do the embryo transfer, because they're seeing a higher rate of success when the patient integrates steaming, and so that's really cool. There was I trained steam practitioners. I remember I certified this one steam practitioner, and she worked with somebody who was doing IVF, and and the woman had already had a couple failed attempts, and then she steamed, and then she was successful. And so she told her other friends about it who were doing IVF. And so this steam practitioner worked with 6 women, and all 6 of them conceived. All 6 of these women were doing IVF, and all 6 of them conceived. So if you guys know the statistics for IVF, they are not 100%, but she had a 100% success rate with steaming in combination with IVF. Which is pretty incredible. And I haven't talked to her in a long time, so I'm not sure if she ended up working with more people. But that was the first time where I was like, oh, wow. Like, I think I've seen steaming used without fertility assistance and be successful, but that was a really interesting for me, because it was the first time I saw it being used with fertility assistance so successfully. And then now there's data about that at that fertility clinic in the Czech Republic, which I just think is tremendous, because they have the tests to show it. She was able to see a difference, in the preparedness of the women who were steaming versus the women who weren't steaming. Sorry, the doctor was able to see a difference, in their readiness for transfer. So I think it's, definitely got a lot of potential to be used in combination with fertility assistance. But even before getting to the point of fertility assistance, if somebody's having fertility challenges, again, we want to look at the stagnation. I'm like a broken record about the stagnation. You want to get all of the old blood out. Old blood, in my theory, is getting in the way of the conception. Okay? So once the sperm and the egg meet, they need to implant into the uterine wall. If there's a lot of old blood in the uterus, how does that, is it getting in the way? Is this not able to make it to the wall? I feel like there are so many ways that old blood in the uterus could be interrupting, the process. So first things first, get all the old blood out of the uterus. And as long as you're getting stuff out of the uterus, get out all of that mucus too. Because all of that irregular discharge, I believe, is also having a problem. So get all of that out so that the uterine walls are clean. Get a nice healthy period, beginning and ending on fresh red blood, a 28 to 30 day cycle without any side effects. And that's going to be a very fertile cycle. So so that's what I do, is I work with people. I actually recommend stopping trying to conceive, because I don't want somebody to steam, somebody who has old blood, for example. I don't want them to steam and then get pregnant that cycle, because again, there's the possibility for complications. That the goal isn't getting pregnant, it's staying pregnant. This person can still end up miscarrying, and I actually see that quite commonly. There's a lot of pressure on women to get pregnant as soon as possible, and so a lot of times women don't want to pause trying to conceive. I recommend pausing trying to conceive for at least 3 months and getting all that old blood out, getting all that irregular discharge out, and then getting to that standard healthy cycle, and then just getting pregnant. If a person hasn't been getting pregnant already for month after month, why not try a different approach? But that's the approach that I recommend. So I recommend pausing for 3 months and longer if necessary to resolve all of the menstrual cycle imbalances. But if you are, in a rush, the fastest thing to do, get an appointment with a Peristeam hydrotherapist who knows what they're doing, who knows how to get you to a standard healthy cycle as fast as possible, in order so that you can have that, a steam conception plan. This is how Peristeam hydrotherapy approaches fertility readiness. And there's a lot of babies. I just gotta say, there's a lot of babies, and you know, I don't know, the steamy babies. You know, there's a lot of babies that have come through because of steaming, and there are people that will swear by it, you know, share their stories. But yeah, from my observations, pausing and steaming for at least 3 to 6 months to get to a standard healthy cycle, and then conceiving, that's the way to do it. Okay, so once somebody's pregnant, we can also steam for labor. So steaming for labor, it's beneficial, I think, just in general. And then it's also really important in an environment where the doctors, you know, say want to induce on a certain timeline. Steaming can be used in place of induction, or to prepare even before induction becomes something that's on the table. Okay, so so I personally, I didn't know steaming could be used for labor. I had used steaming for a missing period, but I was overdue, and so I used steaming, and I was able to get into labor. I was able to progress my labor with steaming. And so I have a class on this called Vaginal Steaming for Labor Preparation. And so, you know, people from all over the world have taken my classes, but one woman from the Czech Republic took my class, and Monika Valova, and then she ended up training a hospital how to use steaming in labor. And now there are over 30 hospitals in the Czech Republic actually using steaming during labor. I got to visit the Czech Republic and talk to the doctors and nurse midwives in these hospitals, and they reported that the patients who steam have much easier, really easeful births compared to the ones who don't steam. That was one of the things that I heard. They, one of the hospitals said that their episiotomy rate came down. They were doing, they do episiotomies. So if somebody, you know, they do episiotomies, which is where you cut in order to make more space if the labor isn't progressing. And they had been trying to get their episiotomy rate down, and they were able to get it to 15%. Once they introduced steaming, it came down to 5%. Again, within a year, they saw it drop, you know, at that rate. Another hospital mentioned that their prescriptions came down by 50% once they started introducing steaming. And so after the first year that they had introduced steaming, she said she would just be waiting around, you know, and again, they weren't needing as much, you know, intervention with the steaming. And so she actually presented that to the entire department, and then they decided to implement steaming 100%, you know, for everybody. Like, it was offered to everybody rather than just once, you know, this patient or that patient, that they offer it to all of the patients. And they also said so far nobody declines it. Everybody's just like, okay, yeah, sure, you know, they're interested in it, and they're not suspicious of it, they're not worried about it. And so so they've seen really great success. And I think that's really important to understand, that it can be used in a medical setting, and when used in a medical setting, that it's measurable, and that it's been shown ultimately to be very successful, so much so that it started to spread like wildfire from hospital to hospital, and they're like, you know, racing to get trained in order to be able to offer the steaming during labor. So really, really great. Anyhow, I recommend steaming starting from 37 weeks. I recommend doing an appointment with a steam therapist starting at 36 weeks in order to prepare and get a steam plan together. And then the steam therapist will decide whether the steaming starts at 37, 38, or 39 weeks. But really important to have those steam supplies in home or in the labor and delivery room. In the Czech Republic, they're really lucky to have it, you know, at the hospital. But birthing centers, home births, and labor and delivery departments, I do think, should have steam supplies and be able to offer it. It's useful for preparing ahead of time. It helps to get the skin ready and the skin more elastic, which can help to prevent tearing. It can be used in the case of stalled contractions. It can be used in the case of water breaking and no contractions have started. It can be used in the case it can be used for pain management in the case that the labor is going long. Oh, one thing I wanted to mention the hospital said that their labors are shorter when people steam during the labor as well. So they were saying that the labors are like 6 hours or shorter when somebody chooses to steam. So pretty incredible. And then after the baby is born, steaming can be used if the placenta is stuck. So it can help with placenta release. So there's a lot of applications for it. And then there is a study, it was a study that I did, the 4th trimester vaginal steam study. It was done for postpartum, but what we saw during the study was that the steam group had lower blood pressure than the non-steam group. So that could also be significant during labor if the person is dealing with hypertension or high blood pressure. It's also possible that the steaming might be helpful at bringing the blood pressure down or keeping it low. Okay? All right. So then, of course, now once the baby is born, steaming is really, really great for postpartum. Labor steaming is pretty simple. You're just going to steam. Like, to tell you the truth, when I did my labor steaming, I did it without any herbs at all. I just did it with water. And you do a mild, you do no heater, you don't have any burner under, you just do a mild steam session, 10 minutes, really, really mild heat level. And that's safe. But in the case of postpartum steaming, it's really complicated because there's lochia, there's discharge coming out, there's still blood, coming out and pregnancy matter. So it's tricky when to start steaming, and it's also really important to understand when there's too much bleeding and to be able to have care around. So steaming actually can be done. Okay, let's see. I don't recommend steaming while the person still has any lochia, unless it's done by somebody who is a skilled postpartum steam practitioner. Okay, and so traditional steam practitioners, traditional midwives will be skilled in this, and then also my level 3 Peristeam hydrotherapists are trained in postpartum steaming and when it's safe to start. But in general, you want to start as soon as possible within the first week, if that's possible, even if all of the discharge, all of the lochia has not expelled. If not doing it with somebody who's skilled and has the ability to stop bleeding, in the case that the bleeding gets too heavy, then just go ahead and wait for the bleeding to stop. So postpartum, the uterus is going through a cleanse, and this cleanse lasts 30 to 40 days. So the steaming helps to make sure that all of the pregnancy matter comes out. Remember, stagnation, we don't want anything left in there that is now going to be stagnation, that's now going to impact the returning menstrual cycle, okay? Or that's going to impact, the quality of life even while the menstrual cycle is paused, the postpartum pause. So getting all of that stuff out is going to be helpful at reducing postpartum contractions. It's going to be helpful to, to protect against infections or any infections that can happen. Speaking of infections, if there's any stitching or any tearing, the steaming is very helpful at helping to reduce infections and helping the stitches to heal. A really great resource is to check out the 4th trimester vaginal steam study, which is the first and only study that's been done about steaming in the U.S. It's only a trial study on a few people, I think 12 women total. But it's really fascinating to see the difference between the steam group and the non-steam group. And when it came to the stitches, for example, the steam group was way better off. When it came to how fast the lochia was discharged, the steam group was way better off. When it came to how the uterus going back down to size and weight loss, the steam group was way better off. So take a look at that. And I think that postpartum steaming in particular, with such a high maternal mortality rate, with unnecessary and preventable deaths worldwide, postpartum steaming is a really, really great self-care tool to have, in the postpartum, room. That can really help the mom in a lot of ways and prevent, any complications that could cause problems. Okay, so I think those were all the topics that I said I was going to discuss. There are more. Just let me know what questions you have, and I can send you in the right way, or I can share with you what my observations are. For anybody who is interested in learning STEAM therapy, check out my training programs. I have 3 levels of training. I have my STEAM techs, that's for like spas or do-it-yourself steaming, where you just got to learn like the safety information and which herbs to use. And there's also an intake form and waiver for people who will be offering it to clients. That's also really good just for like a women's gathering or something like that. I've got my level 2 Peristeam facilitator certification, which has everything from level 1, but also history, studies, OBGYNs that recommend steaming, as well as the culture of steaming worldwide. So then I've got my level 3 certification, which is the Peristeam Hydrotherapist certification. It is the most advanced and only degree in STEAM therapy worldwide. And it combines all of my information from, the studies and clients and just the best practices for using steaming in order to specifically target menstrual and reproductive health concerns. Thank you to everybody who made it this far. I've included a coupon for anybody that is interested in becoming a Peristeam hydrotherapist, and I've also included that free 4-day uterus cleanse class, which is all about period care. Please take it, send it far and wide. Sometimes that itself already gets people started on the right track. And then of course, when combined with steaming, that's like the magic formula. All right, bye hotties. Thank you so much.